A lot of people have been asking about the copper bottles, and we have a lot of questions that we'd like you to answer regarding the benefits, the uh, detriment to maybe drinking too much copper. We've been researching and found that if you store the water in the copper bottle, in about 6 hours, it's killed all the E. coli and salmonella. So they recommend drinking one bottle in the morning and one at night in Ayurvedic medicine to get your trace amount of copper and also to drink clean water. Do you have anything to add to why is it so good for you to drink out of the copper bottles? How do you know when you have too much copper? Should people get tested before they start drinking out of the copper bottle? And what are possible symptoms of too much copper or too little copper?
Okay, in my 35 years of being a physician, I've never seen copper overdose ever. It's a mistake. The vitamin companies have taken copper out of the supplements right now. Uh, it's almost unbelievable because in my practice, almost 100% of my patients had low copper. And low,
Can you give that range? What's a healthy range?
well, you have to check a red blood cell copper. Serum copper is very inaccurate. So if a person has a low red blood cell copper, you also have to check red blood cell zinc because too much copper will interfere with zinc and vice versa. So low copper can be a sign of anemia. So sometimes when a doctor can't correct the iron deficiency, it's due to low copper. Secondly, a low white count or low optimal white count could be another sign of low copper. But copper is involved in a antioxidant system, SOD enzyme system. It helps prevent anemia. It helps make your DNA, makes ATP. So there's so many enzymes that require copper. In fact, if you're low on copper, it's hard to tan, and you're not even going to have a good thyroid. The thyroid needs copper. So there's so many enzymes that need copper, and I'm finding that almost every one of my patients were low on copper. It's real rare to have a copper excess unless you have some genetic disease. Secondly, all you have to do is just check red blood cell copper and zinc to see if you're toxic. So you can measure the red blood cell zinc and copper before the copper bottles, and you can do it a few months later and just see where your levels are. And usually you want to be in the top 75 to 100% on copper because low copper can cause strokes, aneurysms, all kinds of problems.
And what are the symptoms of too much copper?
Well, if you have acute copper poisoning, you can have gastrointestinal problems, you can throw up vomit, you can have bloody diarrhea. That's acute poisoning. Chronic poisoning can affect your kidneys and liver, where your kidney function and liver function tests can be elevated. Sometimes you can have headaches, or you just feel lousy and you feel fatigued from getting too much copper. But low copper can cause some of the same symptoms and side effects as too much copper. So it's not really easy to figure this out. It's better to do a blood test, a real accurate blood test.